Hey guys, we just want to take a couple minutes and shoot a quick video and just talk to you guys about something that a lot of people reach out to our office for, and actually we've had a lot of it this year. I'm not sure exactly why, what that trend is, but I wanted to just take a couple of minutes and talk to you guys about a condition that a lot of people seek our care for, which is commonly referred to as sciatica or sciatic pain, okay? Now, just to kind of recap what that is, in case you're experiencing this and you're not quite sure what it is, sciatica or sciatic pain is commonly experienced with pain and discomfort in the lower part of the spine. That would be like down by your pelvis and your tailbone. That radiates down into the leg and can even go all the way down into the foot, so as far down as the entire lower extremity. It can be on one side. It can be on both sides. It can cause just straight up pain. It can cause numbness and tingling. It can cause a burning sensation. It can cause the leg to be warm or cold. So there's a lot of different symptomatology that goes along with this, okay? But I want to talk to you guys about what it is and a couple different causes, and then what it is that we do to help patients overcome this and help their body to heal up. So number one, what it is essentially is whenever there is pressure on the nerves and the nervous system exiting out of the lower portion of the spine, okay? So that pressure on those nerves will then start to choke off that good flow of communication, that good flow of life over top of the nerves. Those nerves just happen to go down the leg, which is why you experience the pain and discomfort down into the leg and down into the foot, okay? So this just goes along with the same concept that we talk to every single patient about, which is anytime there's pressure on the nerves, no matter what nerve it is, wherever that nerve goes to, your body's just not going to function at 100%. In this particular case, it just happens to be down the leg, okay? So what causes this? Okay, well, there's a couple different things. Obviously, I do think that people commonly think that the pressure and the main problem is right in this lower part of the spine. So it could be damage to the lower portion of the spine. It could be instability. It could be a disc issue. It could be a joint issue. Whatever it is, it's putting a lot of pressure on those nerves, and now those nerves aren't working the way that they should, okay? Now, what is commonly missed, however, is that most of the time, I would say in the vast majority of the time, most people focus in on this lower portion of the spine, but in many cases, like I would honestly say probably 80+%, actually a huge portion of the problem initially is coming right from the upper part of the spine, okay? So when we're looking at the entire body, and this is why when a patient comes into our office, we analyze the whole spine. We don't just want to look at the area of symptomatology. What happens is whenever that upper part of the spine shifts out of its proper positioning, then the entire body has to start to alter to compensate for that. In your body, you actually have something that's called the righting reflex, which is just an inborn reflex designed to bring your head back to the midline and back to center. So essentially what happens is when your head is off, like when your head's not on straight, then your body is going to alter to compensate for that. And so what does it do? It starts to pull a shoulder up, it'll pull a hip up, it'll turn you, it'll do whatever it has to do to bring the head back to center. So the thing is that a lot of times when we're focusing in on this lower portion of the spine, in many cases, we're missing the actual link that's causing that to happen. And so in our office, we obviously analyze that portion of the spine that's causing you pain and discomfort, but we want to look at the whole thing and just make sure that we're not missing any pieces. And like I already mentioned, a vast majority of the patients that we see, their primary area of concern is actually right up here at the top. So just wanted to cue you guys in on a couple of those points in terms of sciatica. If you're experiencing any of those issues, or you know somebody that is, always feel free to reach out to us. You can drop a question in the comments, we'll answer. You can email us, you can call us, you can set up an appointment for a consultation in the office. But if there's anything that we can do to help you, obviously we will. We love and appreciate you guys. Hope you guys have a great day.